Each year, thousands of Australians die from skin-related cancers. And with summer just around the corner, Australians were given a stark reminder of the dangers of sun and sunburn when leading melanoma expert and co-medical director of the Melanoma Institute Australia, Professor Georgina Long, recently addressed the National Press Club in Canberra. Professor Long said urgent action was needed to prevent Australians dying from melanoma, and it's a call backed by skin cancer GPs and the Skin Cancer College of Australia, where they said improving early detection, changing attitudes towards sunburn and sunscreen use, and gathering more evidence for a national screening program are the urgent actions required to prevent a further 14,000 Australians dying from this disease by 2030. Join us to discuss just how dire a situation melanoma is Professor Georgina Long, AO, and the CEO of the Skin Cancer and regular on Skin Cancer College, and regular on the Informer, Lynette Hunt. Welcome, ladies.
Thank you, Michael.
Hi. Thank you.
Now, Professor Long, that's a pretty dire warning that come 2030, if we as a country don't take urgent action to address the problem of melanoma, 14,000 Australians a year will die. 1,400 Australians a year will die. What do we need to do to change attitudes about this?
So at Melanoma Institute Australia, we put together with all stakeholders around Australia a call for government on the State of the Nation. We launched the State of the Nation in 2021, and in that we had a 5-point plan about how we can achieve better outcomes for melanoma, prevent melanoma, and stop that sort of 14,000 people dying. Worse than that, 205,000 people living with the disease, costing the health budget $8.7 billion in the next decade. So we put together a 5-point plan. There were 25 key recommendations across the whole gamut of melanoma. And then at the National Press Club just last week, we took the prevention message, which is across those 25 key recommendations, and pushed those forward, because prevention is better than a cure. And that is the quickest way we can actually make a dent in our goal of 0 deaths from melanoma. It's also a very cost-effective way to really impact melanoma rates and try and get that down to 0 as best we can, and to save $8.7 billion of taxpayers' money that is expended in the next decade on melanoma if we don't do something now. We had a call for action on prevention. I can tell you about that, but wouldn't mind hearing Lynette's comments as well.
Yeah, we've been known as a nation globally for our bronzed Aussie status, and Australians continue to revel in that persona. So how challenging is it to actually change the attitudes and get people to think differently?
That's a really important point, and that was part of our strategy with the National Press Club. So firstly, we were asking government to get behind a sun-safe sports initiative. We love our sports in Australia, and we do it from a very early age. You know, every Saturday we get out with our kids going to do their Saturday sports. And what we're asking for is that sports sun safety is put up there with other sports safety measures. For example, helmets in cycling, life jackets in water sports. Recently, there have been changes with contact sports to prevent concussion, which has very bad long-term effects on people. Similarly, we want to see sun safety up there in that list as encoded into organised sport. So that was the first ask. The second ask was that we need a modernised, long-term prevention strategy that really gets to the heart of our young people. The Slip, Slop, Slap campaign back in the 80s was excellent, but we became complacent. It was stopped in 2005. We need now a modernised, rejuvenated sun safety message for all Australians, but particularly our young people and adolescents. And then thirdly, our ask was for the whole community, but particularly media and social media influencers, to let's change the idea of a tan being the sign of health beauty and success. In fact, a tan is your skin's SOS, as my co-medical director, Richard Scollier, so eloquently said. It's an SOS of damage, and that is what causes a skin melanoma, cutaneous melanoma. So that was our third plea, not just to government, but to everybody, to change that influence over young people, adolescents, and that social sort of norm that having a tan is healthy. It's not. And being a medical oncologist who treats melanoma, especially when it's spread, the tan is actually the sign of heartache and distress and pain and suffering. Yeah. So that's the message we've also got to get across.
Yeah. Now, you mentioned the Slop campaign. If I'm not mistaken, that was actually one of the most successful public health campaigns ever run in this country. Now, I can see it now, and you're welcome to use this, where we have the AFL footballers running out with mouthguard, socks up, as you go out the door, sunblock on, and that's how it should be. It's no different to an OH&S method for them. So, Lynette, at present, how many Australians die each year from melanoma?
It's well over, as Georgina said, it's in excess of the annual road toll, and around 1,400 a year, I think, is correct.
Yeah.
And yeah, so we definitely need to address that. And in addressing the message about sun safety, we also prevent melanoma, but also the other types of skin cancer, which may not be as deadly as melanoma, but certainly do cause death and should not be underestimated, and certainly do cause equal amounts of suffering for people who have chronic issues with skin cancers that just keep recurring and recurring. So again, it comes back to leading that sun-safe life to save yourself that future pain and suffering of being someone with really chronically UV damaged skin, and living with the constant anxiety of, is melanoma going to develop? Or if you've already had melanoma, is it going to develop again?
Yeah. Now, Lynette, we've had you on before as the CEO of the Skin Cancer College, and you say that it's critical that investment in Australian melanoma research be increased and the country's national melanoma prevention and awareness strategy be updated to help prevent the 205,000 Australians that you mentioned from being diagnosed with a potentially deadly condition by 2030, which isn't that far away. How old national awareness strategies aren't cutting it anymore? What needs to be updated?
I think the Slip Slop campaign obviously was hugely successful, but the world has moved on a lot from that time, particularly when it comes to reaching young people and adolescents. They don't watch television anymore. That is not where they get their news and their media from. So having a broader scope through social media and other mechanisms to reach and influence the opinions of those people is really important. Unfortunately, adolescents are one of the hardest groups to reach, but that doesn't mean that we shouldn't try. And certainly using the more modern methods of communication is definitely worth exploring.
Now, Professor, we've talked about deaths, and you obviously see a lot of cases that don't go well, but how many early stage melanoma figures must just be as big a concern where we have a good outcome and they aren't reflected in those figures?
So if we look at all those that are diagnosed each year, we see about 16,000 diagnoses of melanoma each year in Australia. So it's a huge number. And yes, you're right, a lot of that is cured with surgery. So if detected early, a simple excision can cure you. But that still doesn't take away the issue of having scars. You have to have a big, wide local excision. The cost to the health system of removing melanoma, the living with fear of recurrence, not knowing whether you're in that 10% where it will come back. And often when it comes back, it is considered a terminal condition. In Australia, we've done a lot to improve the outcome of those where it has come back and spread around the body, that's advanced or stage 4 melanoma. We've halved or improved, doubled the survival rate. We're curing about 50% of people, whereas 10 years ago, those people would survive only a few months. We've got to apply that same dogged determination that we've used in advanced melanoma to the rest, and that is to prevent it altogether so that people don't have to worry about the scars and that fear of recurrence. And as how Lynette just mentioned, so important is all the other skin cancers that our lovely sun can give us that may not cause as deadly in terms of not causing death as easily, but they are a big problem for the medical system. Recurrent skin checks, recurrent treatments, lots of scars, and they are due to this chronic exposure of sun as well. They cost the health system I think it's $1.7 billion per year just for that as well. So this message is really for all of skin cancer, particularly melanoma because of its deadliness. And it's preventable. It's very easily preventable if we lead a sun-safe life and get the message out there.
Yeah. Now, you've already run through the five-point plan that you've mentioned at the press club. How much do you think the federal government actually needs to invest? What sort of dollars were we talking about? Because we've talked about the billions of dollars in costs to us as a nation. Is it pennies for pounds here that we're talking?
It is. If you look at the cost just for melanoma, $8.7 billion in the next decade. So if you invest now, you're going to get $2 to $4 back for every dollar invested in prevention. It is a no-brainer in terms of the stock market. You'd be there, wouldn't you? $1, I'm going to get $2 to $4 back. So it's the same thing. Invest now, and we will save the health budget $2 to $4 for every dollar we spend now on prevention. Now, how much a good advertising? So there are two parts to it. There's a Sun Safety Sport Initiative, and that's about getting it encoded into sporting bodies' codes of conduct or safety, like occupational health and safety. So that's one avenue. But the other avenue, for example, is the advertising campaign, which is modernized, which is pitched at our young people, which does acknowledge that our young people absorb information differently. It's not like the good old television ads. That, I don't know how much that would cost, but what I can tell you is that the $10 million they spent for 1 month last December was hopeless. It did not do what it should do, and that is reach the people that it needs to reach. And what I also can tell you is the drink driving advertising campaign that's persistent, consistent, and continues has been extraordinarily effective. Or the speeding kills advertising campaign across the nation, extraordinarily effective when we look at holiday periods. We're talking about campaigns that are long-lasting, well-funded, with the best of the best advertising minds to get the message across in every type of platform that will work, including on your iPhone and the social media. I don't know how much that costs, but I can tell you every dollar spent will save you 2 to 4 in the next decade.
Right. And shout out to the dads out there who have a lot to do with. Get your spots checked and cover up, because it's not about you. It's about your loved ones, your families, and the people that care about you, because you're a long time brown bread, and we don't want to do it. So Professor Georgina Long and Lynette Hunt, thanks so much for your time.
Thank you, Michael.
Thank you, Michael.